Advantia Health is a women's health platform based in Arlington, Virginia. We were founded in 2014, and we've now grown to over 40 locations in 5 states with 200 fantastic providers, again, focusing on the women's health space.
Talking about fragmentation, you talk about access and really kind of getting people into the healthcare ecosystem to be able to receive care and to really kind of help out. As we all know, the cost of healthcare continue to explode. And one of the best ways to bring that down is really to just have people regularly interact with their healthcare providers. So how are you kind of able to address those two incredibly challenging issues?
We were looking at, ancillary and expanded services. So back to that fragmentation piece, we're actively looking at how we already are doing it in many respects of expanding the care offerings within our OBGYN practices to provide more services that women want and need. And then thirdly, a couple of more specific things we've done, in addition to focusing on our existing practices, like I just mentioned, is, we launched a de novo practice called Live by Advantia Health, which is in the U Street corridor of DC. And it's really, reimagining the women's health experience in an amazing physical location that really does not look like a doctor's office. And in addition to that, sort of what the woman will experience coming in, it's also, we've created an integrated service offering, where a woman can come in. It's a membership-based model, where they can get primary care, obstetrics, gynecology, telehealth, amongst a number, and mental wellness, and a number of other services that we're continuing to look at and expand. And we're excited for what that's doing. And then the last thing that I'll highlight as it relates to how we're approaching both fragmentation and access, we acquired a telehealth platform called Pacify in 2019. And Pacify is really an on-demand 24/7 lactation consulting, and now expanded to providing doula services to women around the country through a number of payers, that really helps new moms get access to the assistance they need in regards to breastfeeding and other sort of postpartum, and now with doulas even prior to birth. And so we're excited about that.
So you brought up value-based care. Obviously, it's that topic that's top of mind for most people as we think about how to change the bend the cost curve, change the outcomes, and change the cost of outcomes. How are you navigating that shift, and how do you see it impacting women's healthcare providers?
Yeah, so look, we believe in the future. We believe the future is value-based and aligning incentives. And we're already doing a number of things with payers to support this. 2 things I would just kind of maybe just sort of set the table with is, I believe right now, 6 of our current contracts already have either value-based care components or pay for performance components already in there. And then secondly, we're actively negotiating a number of payer contracts now, and in every single one of them, without exception, that we're leading with, we want value-based care components to be part of those relationships with our payers. And so that number of 6 is going to exponentially grow up in 2022. So we think we're, if not ahead of the curve, we think we're right there on the leading edge of embracing value-based care. Look, but I think if you go back to value-based care more broadly, and you just kind of mentioned it, Jason, when the music stops, right? Value-based care is really about, delivering, gaining outcomes through great quality care that then overall will reduce costs. That's the premise of value-based care. And we believe, as I mentioned earlier, we're delivering great high quality care to tens of thousands of women each year through our fantastic providers. And so we believe it's a differentiator, and we're all for leaning in and betting on ourselves. I think though that, with that said though, the way value-based care is currently being addressed between payers and providers is far from perfect. And there's some specific ways that I think that through our experience it needs to improve in order for us to really fully lean in and embrace it to where it's mutually beneficial for both payers and providers.
What are some of the innovations that you're doing at Advantia to kind of evolve and address where healthcare for women is right now?
I touched on 2 that we're incredibly proud of and that we continue to nurture and invest in, which is Live by Advantia Health that I mentioned earlier. And look, our goal is to both use it as an incubator in regards to exporting best practices to our current practices, as well as, we've already imported a number of best practices from our current practices into Live. We'll continue to do that. And, we believe Live will be incredibly successful. And then we'll look to replicate that within our current geographies and perhaps in some new geographies. And then lastly, excuse me, I talked about Pacify. We've gotten great traction with, I think we're probably up to 20 plus payers that are using Pacify with their members across the country. And I believe it's north of 20, and that's, we're growing that platform. We think it's not just vaporware, it's actually delivering some great outcomes that we believe are essential services. And we see that continue to expand. And then we're also actively, as we just added doula services to that, 24/7 on demand. Moms literally, they get on their phone, they launch the app, they click a button, I want to talk to a board certified lactation consultant. And within a minute, they're live 24/7 with one of our lactation consultants. We see that as a really, strong innovation. It's kind of combining sort of this femtech with actually a provider, integrating providers into that sort of piece that's, again, it's not vaporware. We're delivering great services and great outcomes. And we see the potential for that service offering being expanded further as we continue to deliver great value. So those are a couple things that we're excited about, that we think are really on the leading edge of innovation, that we think is delivering, great quality, great experience for our patients, as well as for our providers and for Advantia as a whole.